Welcome to our special program today. We are about to decode the silent messages from your hands with Dr. Charles Whitmore, a renowned medical veteran. Dr. Whitmore has spent over 33 years in the medical field, helping patients understand the subtle language that our bodies use to communicate health risks. He believes the hands are not just tools for grabbing, but actually a complex map reflecting the vital health of your heart and your brain. Most people overlook these small signals, yet they can be the first indicators of serious conditions like silent strokes or early-stage heart failure in seniors. Dr. Reynolds joins him to explore these mysteries, bringing a curious perspective to the table as they discuss life-saving signs everyone should know today. Every twitch, every sensation, and every change in color can tell a story about what is happening deep inside your cardiovascular and neurological systems right now. Today, we reveal 7 critical signs from your hands that could save your life or the life of a loved one from a sudden medical emergency. Let us begin this journey of discovery. Your hands are speaking to you every single day. It is finally time we learn how to listen properly. To understand these signs, we must first look at the incredible connection between our peripheral nerves and our heart, which provides the life-giving blood flow. Every movement of your fingers requires a perfect harmony between the heart pumping blood and the brain sending electrical commands through the nervous system network. When either of these systems begins to fail, the hands are often the very first place where the symptoms manifest due to their distance from the core. Think of your hands as the end of the line. If the power plant or the wiring has a problem, the lights here will flicker first. Simple daily tasks like buttoning a shirt can suddenly become difficult when the brain's signals are interrupted or the blood supply to the muscles is restricted. These subtle failures in fine motor skills are not just signs of aging, they are often red flags indicating that something is wrong deep inside. We often dismiss these moments as being clumsy, but the precision of our hands is a direct reflection of our internal neurological and cardiovascular health status. If the heart cannot pump efficiently, the tiny capillaries in your fingers won't receive enough oxygen, leading to the early signs of functional decline we see. It is fascinating how such a small part of our body can provide such a massive amount of information about our overall survival and health condition. A strong heart ensures that the nerves in your hands remain sensitive and responsive, allowing for the delicate movements that make us uniquely human and capable. Now that we understand the connection, let us look at the first group of signs. These specifically warn us about the looming threat of a stroke. The first sign is sudden weakness. If you find yourself dropping objects unexpectedly, it could be a sign that a portion of your brain is struggling. A stroke doesn't always hit like a lightning bolt. Sometimes, it starts as a gentle slip, a momentary loss of power in your dominant hand's grip. If your arm feels heavy or your hand suddenly refuses to follow your commands, do not wait. This is a critical SOS signal from your brain. Typically, this weakness occurs on only one side of the body. If one hand feels perfectly fine while the other fails, the danger is very high. Sign number 2 is numbness or a tingling sensation. It might feel like pins and needles that simply won't go away, regardless of your hand's position. When you lose the ability to feel texture or temperature in your fingers, it indicates that the sensory pathway to your brain is being seriously compromised. Unlike when your hand falls asleep from a bad position, stroke-related numbness usually happens without an obvious cause and persists despite moving the limb around. The third sign is uncontrollable trembling or a sudden tremor. If your hand shakes when you try to perform a simple task, pay very close attention. This isn't the typical tremor seen in Parkinson's disease, it's a new, sudden instability that disrupts your ability to write or hold a steady cup. We must always remember the F.A.S.T rule. A stands for arm weakness, which includes your hands. If one arm drifts downward, it is an emergency. Try this now. Lift both arms. If one side feels heavy or drops, your brain is telling you that every second counts for your survival and recovery. Time lost is brain lost. These hand signals are your early warning system. Do not ignore them, even if the symptoms seem to fade after a minute. Weakness, numbness, and tremors. These are the 3 primary hand matters of a stroke. Recognize them quickly to give yourself the best chance for a full recovery. It is better to go to the hospital for a false alarm than to stay home and miss the window for life-saving treatment during a stroke. Moving forward, let's talk about the heart. I want to share the story of Raymond, a patient who taught me a lot about silent heart failure. Raymond came to me complaining about something very minor, a dry mouth. He felt like he couldn't drink enough water to satisfy his constant thirst. While it seemed like a simple case of dehydration, his history suggested something deeper. Chronic dry mouth in seniors can actually be linked to heart health. When the heart isn't pumping effectively, The body prioritizes blood flow to vital organs, often leaving the salivary glands and extremities with less than they need. Even more dangerous is that a dry mouth allows harmful bacteria to flourish. These bacteria can enter the bloodstream and cause serious infections in the heart valves. This condition, known as endocarditis, can lead to sudden heart failure. Raymond's dry mouth was actually an early warning sign of his heart being under attack. Looking at Raymond's hands, I noticed the fourth sign, clubbing. His fingernails were curving downward and the tips of his fingers looked swollen and bulbous. Clubbing happens when there is a chronic shortage of oxygen in the blood, causing the tissue at the ends of the fingers to thicken and change shape. The fifth sign is a blue or purple tint in the fingertips. This is called cyanosis, and it means your heart isn't delivering enough oxygenated blood. In Raymond's case, his heart was struggling so much to keep up that his extremities were literally gasping for air, turning blue as a silent cry. He hadn't noticed the changes in his fingers because they happened so slowly over time, illustrating how these signs can be easily missed by the patient. It is truly eye-opening to see how a simple symptom like thirst or a change in nail shape can point toward a failing heart valve or infection. By the time Raymond came to see me, his heart was already in a state of distress that required immediate and very intensive medical intervention to save. Thankfully, because we caught it after identifying these hand and mouth signs, we were able to treat the infection and stabilize his heart health for years. Raymond's story is a reminder that our bodies give us clues long before a major collapse happens. We just need the knowledge to recognize those specific clues. Now, let's move on to the final two signs and some simple tests you can do at home right now to check your own cardiovascular health. Sign number 6 is swelling on the back of the hand. If you press your finger into the skin and it leaves a lasting dimple, that is edema. This fluid buildup happens when the heart can't pump strongly enough to move blood back up from the limbs, causing liquid to leak into the tissues. The seventh sign is palmar erythema, or unusually red palms. While sometimes linked to the liver, it can also indicate changes in hormone levels and circulation. If your palms look like they are blushing or permanently sunburned, it is worth discussing with your doctor to rule out underlying heart or systemic issues. Now for the cracker test. This is a simple way to check if your mouth is producing enough saliva, which is a key indicator of circulation. Try to eat a dry cracker in under a minute without any water. If you can't swallow it easily, your saliva production may be critically low. Failure to pass this test suggests that your autonomic nervous system or your heart's output might not be supporting your body's basic lubricating functions properly. Next is the sticky cheek test. Use a clean finger to touch the inside of your cheek. It should be slippery, not tacky or like glue. If your finger sticks to the inside of your mouth, it's a sign of dehydration or poor blood flow to the oral tissues, mirroring Raymond's condition. These tests are simple, but they provide immediate feedback about how well your internal systems are functioning on a very basic and essential level today. If you notice dry mouth, start by sipping water frequently and chewing sugar-free gum to stimulate saliva. But also check your medications with a doctor. Many common medications for blood pressure or depression can cause dry mouth, but it is vital to distinguish side effects from actual heart distress signs. Make it a habit to inspect your hands every morning. Look for changes in color, texture, or any new swelling that wasn't there the night before. Prevention is always better than cure. By noticing these 7 signs early, you are giving yourself the ultimate gift of time and health for the future. Let's recap: sudden weakness, numbness, tremors, clubbed nails, blue tips, hand swelling, and red palms. These are your 7 guardians of health to watch for. Seeing these signs shouldn't fill you with fear. Instead, let them be a call to action to live a more mindful and health-conscious life every day. Our hands do so much for us throughout our lives. They work, they touch, they comfort, and they also protect us by signaling when help is needed. As we conclude, I want to emphasize that these signs are friends that remind us to slow down and take better care of our aging bodies. The wisdom of the body is immense. Dr. Whitmore, your insights today have truly illuminated the path to better understanding our own internal medical health. A healthy heart and a sharp brain are the foundations of a long life. Your hands are the messengers that bridge the gap between them both. Do not take your dexterity for granted. Treasure the ability to hold a pen, a tool, or the hand of a grandchild for as long as possible. If you see something, say something. Talk to your healthcare provider about any of these signs immediately. It could truly be the most important conversation. Always remember to listen to your body and cherish the life you have. Your hands are telling a story. Make sure you are there to hear it. Thank you for joining us for this deep dive into the secrets of the hands. We hope this knowledge empowers you to live a safer life. Stay curious about your health and stay vigilant. Your hands are the map to your heart, and your heart is the rhythm of your beautiful soul. Until next time, take care of your hands, take care of your heart, and take care of each other. Goodbye and stay healthy, everyone.